Next, I will go over a anesthetic and peri-anesthetic protocol for Oliver and his mast cell tumor removal. We did the blood work and his kidney and liver are functioning well. Actually, all of his blood work was within normal limits. So due to his age and the fact that he's not very nervous, we're not going to add in any acepromazine to his pre-anesthetic. We're just going to give him morphine. This is a pure opioid and will last 1 to 4 hours. So this is part of our multimodal analgesia. We're going to administer it at 0.5 milligrams per kilogram of his body weight. That's on our higher end, but he is having a mast cell tumor removed, and the doctor needs to get large margins, so there's going to be pretty big incision. So we'll give that to Oliver. We'll wait 15 minutes, and then we'll give him a combination of ketamine and Valium. Ketamine is a dissociative anesthetic, and basically it reduces the amount of the inhalant for the general anesthesia that will be needed, and we'll combine this with Valium or diazepam. And we already have a pre-mixed bottle of ketamine and Valium, and we'll administer that at 1 milliliter per 20 pounds of body weight. And so basically the Valium is a benzodiazepine, and it can hasten the induction. So we'll use that for induction. Then we will put the pet on a gas anesthetic. We will use isoflurane. That is what we use at our clinic for pretty much all surgical patients. After the procedure, we will give Oliver a non-steroidal anti-inflammatory drug called Rimadyl, and we will give that subcutaneously, and we'll give him 2 milligrams per pound of body weight, and that'll be his 24-hour dose, and that should last him till the next day when the owner can start on giving Rimadyl as a pain medication to go home with. So if his kidney or liver values were elevated, we probably would have chosen a different pain management protocol, but for Oliver, who has really, healthy blood work, we're going to use the Rimadyl, and that'll be, that multimodal effect. So he'll have the morphine on board already, and then he'll have the Rimadyl for a longer lasting effect. So that will be the anesthetic protocol for Oliver. And we'll have the doctor confirm that this is what she would like us to use, and then we will begin with administering the medications. The morphine we administer subcutaneously, and then we induce the pet with the ketamine and Valium. And that goes intravenously into a catheter that we'll have placed already. And then, like I said, the Rimadyl will be subcutaneously. The pet will have an endotracheal tube in for the gas anesthesia, isoflurane during the procedure.